My name's Kate, and I would like to talk to you about why the Qantas travel grant should help me go to Tokyo, Japan. I work for and study at the University of Melbourne. I'm the Data Operations Manager for the Melbourne Brain Centre at the Royal Melbourne Hospital and a Master of Information Systems student. My work and studies are aimed at developing and improving the information systems used by medical professionals and enabling these systems to collect data that can be used by researchers to produce better patient outcomes. In order to explain how travelling to Japan would be a fantastic learning opportunity, let me tell you a story. You're out at the beach with the kids on a Saturday afternoon. You take an unfortunate beach ball to the head and briefly lose consciousness. When you surface, you find yourself surrounded by green aliens whose appearance is reminiscent of a Ninja Turtle. The aliens take you to a big building filled with lots of other green aliens who move you from the trolley to a bed. You don't trust the green aliens, so you refuse to give them any information. The same afternoon, at your local hospital, the resident emergency doctor sees a patient who has suffered head trauma. The patient appears to be disorientated, won't answer questions, and is babbling about green aliens. The patient is also having trouble breathing and has a rash on his head and neck. The doctor notices that the rash is appearing in the places that the medical team have touched the patient's head and neck to look for lacerations. You have a latex allergy, a condition that you and your GP know about. Your medical team recognises and treats your allergy, and your breathing improves. Solving the green alien problem is a more complex issue. As your medical team continues to care for you, you realise that they are not aliens, but healthcare staff who are trying to help. You explain to them that faces appear green and swollen. Your medical team has never had a patient report this symptom. They search your literature and find nothing. The alien appearance of faces spontaneously resolves and you're sent home. A few months later, you have a small spike in temperature thanks to a bug that your immune system tackles without you even noticing. Simultaneously, your green alien aura reappears. Disturbed, you go to see your GP. Your temperature is found to be within the normal range. The GP is shocked to hear your symptoms and has no record of your admission to hospital. Your medical team would have sent a copy of your discharge summary, by snail mail, to your GP. Somewhere between the hospital mailroom and your GP's administrative assistant, this single piece of paper has gone missing. The GP has never heard of these symptoms, fears that you are having a psychotic episode and that you may be a danger to yourself or others. He admits you to the psychiatric wing of the same hospital that treated your head trauma. After many hours, your medical records are located, the unbelievable story of your head injury is confirmed, and you are discharged. How could the effective use of medical data have improved this episode? Most GPs collect their interaction details electronically. However, these systems are not accessible outside their practice. If data could be shared securely with hospitals, your medical team would have known about your latex allergy and could have prevented the allergic reaction that you suffered. Reciprocal information could also be shared from the hospital to the GP, eliminating the chance of that vital piece of paper being lost in transit. This would have avoided your admission to the psychiatric wing of the local hospital. The team that I plan to visit at the University of Tokyo Hospital have developed a system to solve this problem. I also have contacts at Hitachi who are working to implement similar solutions for the National Health Service in the UK. Please note, while this story is fiction, this next part is even more so. The green alien aura is a rare condition caused by insult to a very specific part of the visual cortex. This condition has been known to resolve if the patient is treated with oxygen therapy within 48 hours of the insult. However, as the condition is so rare, this information is not published. Had the hospital that was treating you had a sophisticated electronic medical record system, your doctor could have searched for patients who had reported green aliens, their treatments and outcomes. This would never replace thorough systematic medical research methods, but in cases where no published information is available, can guide the decisions made by clinicians. The system that I would like to investigate at the University of Tokyo Hospital addresses this challenge. Real-time remote health monitoring would have noticed a small spike in temperature at the time that the green alien aura reappeared. This spike is too small to be detected by ad hoc monitoring, and so no link was made between these events. My proposed visit to Toyota's big data centre is designed to investigate how they are managing the high volume of real-time monitoring data generated from traffic systems and how we can apply these lessons to self-monitoring and health. How can we manage the streams of data generated by self-quantification? How can we share information between our health systems? I hope that the Qantas Travel Grant will help me find out.